There were so many patients who truly, we saw patients coming in and out of the hospital and in and out of the hospital. And what we often found was that if those patients took their medications properly, they could not only avoid going into the hospital, but also avoid being on the number of medications they are.
Now, our healthcare system is something that definitely makes the news quite a bit, and streamlining services for patients, so they're not tied up, they can get the healthcare they need. That's constantly like an issue that's being discussed. Can you share a little bit about your background and what made you start the company?
Yeah, so I actually grew up in independent pharmacy. So all those mom and pop pharmacies that you see, that was me behind the counter with my family. And I grew up there, and I began to really build a passion for what pharmacy was capable of doing, especially with the way that pharmacists were able to connect to patients in the community, and really close the gap between, patients who were looking for advice that was in a pharmacist's scope of practice and what they were able to do. So I decided when I was in college to potentially bring in a packaging machine that would typically be found in a long-term care pharmacy model into the community so that my family could start providing adherence-based pharmacy services to patients who needed them at home. What happened was we ended up launching Centennial Pharmacy Services, which became what we like to call a medication management company. So, at the core of our business, we dispense medications, but we actually provide all types of pharmacy services that surround dispensing the medications. That includes different types of medication packaging. We have care services. We do different types of vaccinations, point of care testing, anything that a pharmacist is able to truly make an impact with a patient in the community, we'll support that. And we either support that with services directly to the patient or by doing some type of collaborative practice with their providers, or even potentially their insurance company or whoever it may be that needs the support for those patients in the community.
And that's great because I know the pharmacist, at least for me, when I go, they know more usually about the medications you're taking, the side effects that it could have with other medication, than the
That
doctors
is
sometimes.
their expertise.
Yeah,
So yeah,
definitely.
yeah. No, I mean, it's true. There were so many patients who truly, we saw patients coming in and out of the hospital and in and out of the hospital. And what we often found was that if those patients took their medications properly, they could not only avoid going into the hospital, but also avoid being on the number of medications they are. Oftentimes, patients will go to the doctors and they'll kind of like yes their doctor to death. Like, oh yeah, I take my meds. And the doctor looks at the chart and goes, oh, your blood pressure is a little off. And so they get put on another medication. And here, if the patient just truly took their medicine like they were supposed to and they followed the directions, they could not have to be on those medicines. But it's not necessarily the patient's fault. Like these medications, they're confusing. They're hard to pronounce. It's overwhelming to get a bag of medication from a pharmacy. So being able to provide them their medications organized by date and time, it makes it so much easier for them. It makes it so much easier for their caregivers. It really is something that truly makes an impact to the patient and a tangible impact right away.
Right. It sounds like it. And now, what are some of the services that long-term care at home pharmacy quality they offer? Like, what do you do? What are some of the things?
Well, one of the interesting things was that when we were going along with Centennial and we were growing in our community, so we're actually headquartered in Philadelphia. We support Pennsylvania, New Jersey, and Delaware currently. We had a lot of pharmacies that were coming to us and saying, "Hey, this is a really neat service that you're providing. How can we do this at our pharmacy?" So we started to look for solutions in the market to be able to offer pharmacy support with incorporating this level of service into their pharmacy. What the pharmacy industry likes to call this level of service is long term care pharmacy at home. And that is a pharmacy that's providing a patient a long term care level of service. So, medication packaging, 24/7 availability, care coordination, so on and so forth. But instead of providing that to the patient in a facility, they're providing it to the patient at home. We started educating the industry and getting solutions out there for pharmacies. But what we often found was that it was extremely difficult for not only pharmacies to understand how to incorporate this, but for plans and payers to trust that the pharmacies were doing this compliantly. So we decided to launch the Long Term Care at Home Pharmacy Quality Commission so that there was a solution in the market for health plans, payers, pharmacies, anybody in healthcare who's looking to incorporate this level of pharmacy service into their ecosystem, a solution for them to know that they could come to someone and it could be rolled out in a compliant way.
That's great because that definitely is like that piece that's missing in between. You go to the doctor, you get, and I think like, would this be like I'm thinking of patients like the ones who have like are diabetic, maybe like they have long-term knees or heart issues, like people who are going to have to be on their medication for, probably the rest of their lives or whatever. They would
100%. Yeah, this is your chronically ill. So we typically look at this population as patients who have 3 or more chronic conditions. Those chronic conditions can be, diabetes, heart disease, behavioral health is a big one, different types of cancers that, patients are living with in the community. There's an entire list of chronic diseases that, will qualify a patient for this level of service, but a lot of them are unfortunately common. There's look at how many patients are diabetic or have heart disease in the country. There's a lot of medications that go behind managing that condition.
oh, definitely, and yeah, for sure, and then again, like you said, you have to watch out how they if they're taking them, are what are they taking as well? Like, that needs to be, like, in the system because sometimes that gets overlooked or something, so
Absolutely, and we see interactions every single day, and we see interactions just from patients not understanding or caregivers not understanding, that they need to tell their doctor that a medication like a warfarin, for example, which is a blood thinner, warfarin and Coumadin the same medication, but a lot of patients don't realize that that's the same medication because one's a generic and one's the brand name. They'll tell their doctor or their doctor may not realize that they have t that they're on 2 different medications because it may be 2 different providers that's giving it, or they'll go to different pharmacies. Polypharmacy is a big issue because they'll go to different pharmacies and they'll get one prescription filled here, another filled here, and all of a sudden they have multiple medications for the same med in the home, and it's dangerous. It truly it puts people in the hospital.
and I know we're gonna talk about too, what are some of the other issues that you see when it comes to quality, patient services in this sector?
So, one of the biggest things that we like to ensure when it comes to the quality control of long term care at home pharmacy is that the pharmacies who are providing it are actually meeting the standards for long term care. One of the things that CMS does have, let's call it regulations out for when it comes to providing long term care pharmacy services and being able to engage with long term care pharmacy Medicare Part D contracts. So, to be able to bill for the prescriptions is that a pharmacy needs to meet their standards of long-term care pharmacy. That includes specialty packaging, different types of comprehensive inventory, the availability to provide IV compounded medication, 24/7 access. There's a whole list of them, but uh, what we like to ensure is that the pharmacies that are actually providing this level of service are meeting that standard of care and also able to answer those 24/7 calls and provide access to those IV medications if necessary. Additionally, we like to ensure that the pharmacies are actually providing this level of service to the correct patient. So, one of the big things that we have is a qualification attestation sheet for the pharmacy to utilize and keep on file. That piece of documentation is very, very big, especially when it comes to the health plans and the payers, to ensure that not every patient is walking in the door and getting this level of service. And that's because there typically is an additional reimbursement that's involved with it. So we like to make sure that the pharmacies are actually qualifying the patients properly, that it's a specific patient population that's receiving this level of care, and that the patients who are receiving this level of care are getting it from a pharmacy who's meeting those standards.
And, also as far as incorporating this collaborative, how do they do that inside these, like, programs? Like, how do you support better health outcomes when they're doing this? Like, what are I guess, the outcomes from this? Like, the benefits.
Yeah, one of the biggest things that we see is increased adherence for patients. When a patient is adherent to their medication, it's really incredible what difference it can be in, not only the difference that they feel and they see, but the difference in their metric outcomes, the ones that like CMS regulates in a value-based system. The most impact that a pharmacy can make is making sure that they are communicating with the patient and getting that refill out to the patient. And if the patient doesn't want that medication or is requesting not to have that medicine refill, asking why. Why do you not want your medication refilled? Is it because of a symptom that you're experiencing? Is it because you don't want to take this many medications or you saw a commercial and you don't think you need to be on this medicine anymore? There's so many different reasons why a patient does not take a medication, but being able to have an open and honest conversation with the patients and understand from them why they don't wanna take that medication is a big deal, and sometimes it can be as simple as, "I don't like taking medications at night," and at the pharmacy, that's a phenomenal conversation for a pharmacist to be able to have with a provider to say, "Hey, Mrs. Smith doesn't like taking meds at night, she falls asleep early, she forgets. Let's try to get her on a regimen where she only has to take medicines once a day." Those are the real differences that the pharmacy can make, and it makes a huge impact into their health outcomes, the way that their conditions are managed, and even the different types of measured outcomes that the value-based systems are seeing.
And now, what do you see happening as we go? Do you see this being implemented, this type of system being implemented like across the country? Is it something you want to see go further?
I do. So, I really believe that there's only going to be a few segments of pharmacy that end up out there in 10 years. I think that you're going to have chronically ill patients who are living in the community that are being supported by this long-term care at home, chronic support pharmacy, like Centennial Pharmacy Services. Then I think that you're going to have your long-term care pharmacies that are doing your traditional facility-based care for those acute needs or those severely chronically ill. And then I believe that you're going to have your, kind of your stat pharmacies, let's call them, where they're going to fill things like your quick antibiotics that need to go out to a patient, or maybe for your younger patients who, don't need the level of service, or your patients who potentially maybe only have one chronic disease who don't need the same level of service. Um, you know, we have a big problem coming up in this country, and we like to call it the 2030 problem, but all of the baby boomers are aging into 65 and older. And when that happens, they're gonna break healthcare because they've broke everything else. So, we really need to put solutions in place, and pharmacy is an extremely accessible, cost-effective solution, for the entire healthcare ecosystem to be able to rely on. Not only that, but as this population ages and as they get sicker and sicker, there's just simply not enough beds. I talk about this a lot at industry conferences, but those long-term care facilities, they're shrinking. And patients, especially after COVID, they don't wanna go into a facility. They saw what happened. They don't wanna end up in a facility like that. So the need for facility care is going to increase, but the availability and the want for facility care is decreasing. And pharmacy can meet that gap perfectly because we're able to really help and support the healthcare ecosystem, whether it be the community providers or the managed care organizations, the accountable care organizations, and we can truly make a difference with those patients who are living in the community.
Kind of help them from having to go into the hospitals or into the cares, if we can, I guess, like prevent those problems from getting worse or kind of keep them under control because you're taking your medication the way you're supposed to and doing the things. Is that kind of like I guess, the point behind it?
That is the point. Yep. Take your medication properly, and you're going to be able to decrease the amount of medication that you're on and end up not going into the hospital as often. It's proven in studies again and again and again. We just need to make sure that the patients, one, have an easy way to do it, that the caregivers are supported, and that the hospital systems and the providers understand that there are solutions in the market to help them.
Yeah, that sounds great. Now, I do. Now, if people want to know more about what you do in the company, where would they find information? Just go to your website.
Yeah, you can find, information on Centennial Pharmacy Services. We are growing, we're expanding, we're so excited to be able to, start to go into other states. So, it's centennialpharmacy.com. And then if you are a healthcare ecosystem that's looking into incorporating long-term care at home pharmacy services, you can go to LTC at home pharmacyqualitycommission.com.
Awesome. And this would be for any like hospitals, doctors' offices, anything like that. Okay.
Absolutely. Yeah, we have solutions for, how all aspects of healthcare can truly integrate with pharmacies like this.
Well, that's very cool. I'm glad it's pretty I like the concept, so I hope it definitely continues to grow and everything because I know even with my dad, he does not take his prescriptions like he's supposed to.
Yeah, listen, I preach this and, I get upset at myself because my medicines, which are mostly vitamins, I don't put them in compliance packaging, and I'm like, "Ah, I forgot again," and, here I am preaching this, so I get it, it's hard.
Right? Helps us keep in line.
Yeah, exactly, exactly.
Well, I appreciate you being with us today and thank you very much. And I hope everything continues to grow and thrive. So
Well, thank you so much, it was great being here, I can't thank you enough for having me.